wallboard, in pipe and boiler insulation, joint compound, and gasket materials, and in spray-applied uses such as fireproofing on structural members. Asbestos is divided into two groups, serpentine and amphibole. All asbestos in the serpentine group is called chrysotile, or white asbestos, because of its natural color. Chrysotile is the most common type of asbestos found in buildings in the United States, accounting for about 95%. What is most important to remember about all this is that the crystals of asbestos form long, thin fibers of material invisible to the naked eye. These fibers become airborne when the ACBM deteriorates or is compromised by abrasion, cutting, or other damage. Inhaling asbestos fibers leads to an increased risk of developing several diseases, most of which take 15 to 30 years to develop. The greater the exposure to airborne asbestos fibers, the greater the risk of developing an illness. The National Institute for Occupational Safety and Health has determined that there is no established safe level of exposure. And that is why following the AHERA requirements is so important. Your ultimate objective is to protect the health of the school building's occupants by preventing the release of asbestos fibers. Your responsibilities as a DP have been determined under the AHERA rule. Let's review these responsibilities. The DP must ensure that inspections, re-inspections, periodic surveillance, management plan creation, contents implementation and updates, and maintenance and removal of ACBM are all carried out in accordance with AHERA requirements. The DP must ensure that employees who will not disturb asbestos receive a minimum of 2 hours of awareness training. Employees who may make repairs involving ACBM must take additional training. All workers, building occupants, students, and their parents must be notified annually about recent and upcoming asbestos-related activities and the availability of the asbestos management plan. The DP must ensure that repairmen and other short-term workers who might come into contact with asbestos are provided with information regarding the locations of this asbestos. That warning labels are posted on or next to any ACBM located in routine maintenance areas, such as boiler rooms. And finally, the DP must also consider any conflicts of interest. For example, the company that does the asbestos removal should not collect the samples that will determine whether the area is free of airborne asbestos fibers and safe for reoccupancy. The first step in the process is the AHERA inspection. An accredited inspector must conduct the initial inspection and all re-inspections under the LEA's authority. An AHERA accredited inspector has attended and successfully completed an EPA-approved training program, passed an exam, and received an accreditation certificate. Refresher training must be completed regularly. The DP must keep documentation of the inspector's accreditation in the management plan. The DP must check to make sure the inspector who conducts the inspection or re-inspection has a current and valid accreditation certificate. Inspections begin by visually locating and listing all areas that contain or are suspected of containing asbestos. It is recommended the DP accompany the inspector to make sure the inspector has covered all buildings and areas likely to contain ACBM. Portables, trailers, storage buildings, and garages are often missed. Surfacing materials such as plaster and sheetrock are probably the most often overlooked materials. Suspect materials may be assumed to contain asbestos or sampled and submitted for analysis in accordance with AHERA requirements. If suspect materials are assumed to be ACBM, then they must be treated as ACBM. The DP should make sure the inspector takes an adequate number of samples and describes the locations of the samples in enough detail so that in the future others can find where the samples were taken. Only laboratories accredited through the National Voluntary Laboratory Accreditation Program, NVLAP, may be used to perform sampling analysis. As long as any ACBM remains in a school building, the DP must make sure that re-inspections of the initially identified ACBM are conducted every 3 years. When a new building is built or acquired, the DP must assure that an inspection is conducted or get a statement from the architect or builder that ACBM was not used in the design nor the construction. For each inspection or re-inspection, the inspector must perform a physical assessment on the condition of all ACBM or suspected ACBM in the building. The results of inspections, re-inspections, and physical assessments must be documented in an inspection report that goes to the DP, who must ensure that all elements have been included. The DP must receive the inspection or re-inspection report and written assessment within 30 days of the inspection. The management planner then uses the report to write recommendations on appropriate response actions for the remaining ACBM. Since the management plan is the basis for all asbestos work done in the school and a guide for anyone who does maintenance or custodial work, each school building must have such a plan. Even portable buildings and buildings not used as classrooms, such as gymnasiums, garages, and storage areas, need to be covered by this plan. The DP is responsible for ensuring that the asbestos management plan is implemented. So the plan should be clear, easy to comprehend, and very usable. Also, certain records must be kept current and complete in the management plan. These are the names and addresses of all school buildings and whether the buildings contain ACBM or suspected ACBM. AHERA designated person information, name, address, phone number, all training courses, and when they were taken. Inspection and re-inspection reports, including physical assessments and recommendations, and sampling results. Description of the operations and maintenance program. Documentation on operations and maintenance activities. Documentation on response actions, fiber releases, preventive measures, air clearance sampling. Accreditation certificates for the individuals inspecting, designing, and conducting response activities. Updated information on locations of ACBM. Planned activities, such as the re-inspection schedule, operations and maintenance activities, and periodic surveillance. Copies of and information on required notifications. 6-month periodic surveillance reports, and documentation on the training for maintenance and custodial staff. A copy of each facility's asbestos management plan should be in the administrative office and in each school building. Staff should know its location and understand how to use it. The plan must also be readily available to the public. When a school is found to have asbestos-containing building materials, the DP must assure that an effective written operations and maintenance program, O&M program for short, is in place. The purpose of the O&M program is to safely manage the asbestos and minimize future asbestos fiber releases by controlling access to the ACBM and instituting proper work procedures. What does this mean? In buildings where ACBM is present, routine maintenance such as work on lighting, plumbing fixtures, pipes, HVAC systems, ducts, and other accessible parts of a building's utility system can disturb ACBM and raise levels of airborne asbestos. A prevalent source of ACBM in school buildings is vinyl asbestos tile, called VAT. If VAT is damaged during routine floor care, such as removing floor wax and buffing with powered equipment, asbestos fibers can be released. The DP must instruct maintenance workers not to perform any maintenance work that could disturb ACBM unless they are trained and use the correct procedures. Then, before the asbestos-related work can begin, the DP must ensure that the employers, either the LEA or the contractor, have medical surveillance and respiratory protection programs that meet the EPA Worker Protection Rule or OSHA regulations. One of the ways the DP can minimize disturbances of ACBM during maintenance and renovation work is by using a permit system that requires all work orders and requests be processed through the DP. That way, the DP knows what area is involved before any work is done and can review the management plan to see if any exposure potential exists. At least once every 6 months after the management plan is in effect, the LEA must conduct a periodic surveillance for each building containing ACBM or suspected ACBM to see if the condition of the ACBM has changed. The LEA assigns someone to do the periodic surveillance. Usually, the person conducting the 6-month surveillance is someone from the custodial staff who has received asbestos awareness training. The reports generated from these periodic surveillances are kept in the management plan for each school building. AHERA requires that 2 specific notifications be issued annually. One is a notice of all inspections and activities planned, in progress, or recently completed to control asbestos exposures. The second is a notice informing parents, teachers, and employee organizations of the availability and location of the school's asbestos management plan. These notifications are frequently published in the school's newsletter. Dated copies of these notifications, along with a description of how they were distributed, also need to be kept in the management plan. For short-term workers, such as repairmen who may come into contact with ACBM, the notification may be a written description of the locations of ACBM or suspected ACBM in the building. The workers would then sign a log stating they had read and understood the information. Warning labels are required to be posted on or adjacent to any ACBM or assumed ACBM that is located in routine maintenance areas. Based on the recommendations of the management planner, the DP helps to select the methods that will be used to manage the ACBM. All actions must be carried out in a timely manner and in compliance with the AHERA requirements. What are your options? The O&M program is vital since the work practices in it are designed to keep ACBM in good condition and prevent releases. Next is repair, which means returning damaged ACBM to an intact condition by replacing limited sections or patching damaged areas. Encapsulation is another option. This involves treating the ACBM with a coating material that adheres to the exposed ACBM surfaces. Encapsulants can be applied to the material surface using airless spray equipment at low pressure to minimize the release of asbestos fibers during application. Enclosure involves creating a permanent, airtight, impermeable barrier around the ACBM. Finally, there's removal of the ACBM from a specified area. Persons accredited through an EPA-approved training program carry out most of these activities. And for many of these activities, final clearance sampling must be conducted and analyzed by an NVLAP accredited laboratory. Although AHERA does not require the DP to be accredited, AHERA does require the DP to be adequately trained on certain topics. These are the health effects of asbestos, detection, identification, and assessment of ACBM, options for controlling ACBM, the Asbestos Management Program, and related federal and state laws, NESHAP's OSHA, DOT regulations, and the EPA Worker Protection Rule. Remember, the presence of ACBM in a building does not mean the building's occupants are endangered. Although asbestos is hazardous, intact and undisturbed ACBM does not pose an exposure risk. ACBM that is properly managed is not likely to release asbestos fibers into the air. Through your efforts as the DP, you play a strategic role in assuring that ACBM is managed in a manner that protects the health of the building's occupants. By viewing this video today, you have learned more about the responsibilities associated with your position. We encourage you to contact the asbestos coordinator in your EPA regional office to answer questions and provide you with additional information.